Hello everyone, and now we are coming to a second interlude in the ECG course. We have discussed many topics in the first season of the ECG course, like the basics of ECG, the axis, the atrial ventricular enlargement. We discussed bundle branch blocks, fascicular blocks, arrhythmias of course. And so in season 1 we focus on basics of ECG and arrhythmias. So what did we do in this season 2, which we have already finished? Of course, we discussed at first the preamble to the myocardial ischemia, including the three categories of STEMI, non-ST elevation, acute coronary syndrome, and chronic coronary syndrome. We discussed the ECG in STEMI, which is different features. Then we discussed left main equivalent and transient ST elevation. We also discussed the tombstone appearance and the famous De Winter syndrome. We discussed, of course, two interesting lectures about the posterior MI or posterior STEMI, as I prefer to call it, and RV infarction and how to diagnose them. We also asked three important questions. The first one was acute or chronic left bundle branch block, STEMI or L repolarization pattern, and STEMI or pericarditis. Also, we discussed the ST segment in AVR, and we corrected, of course, many misconceptions about this and unresolving ST elevation and its clinical significance. We also discussed famous queer ECG pattern for STEMI and how to diagnose them in order not to omit the chance for revascularization for those patients. Also, we discussed two interesting topics about tachyarrhythmias with acute coronary syndrome and bradyarrhythmias with acute coronary syndrome, which was like a connection between the two seasons. We then moved to ECG in non-ST elevation acute coronary syndrome, and we discussed its different patterns in this category. We discussed Vellens syndrome and pseudonormalization pattern and how to detect them. We discussed resting U wave inversion and low QRS voltage, which seem to be two unfamous patterns in the ECG, but of course clinically significant. We then moved to ECG in chronic coronary syndrome, and we discussed the importance of having resting ECG in those patients. Then we have, of course, different lectures that were collective or resumé for ST segment elevation, then for ST segment depression to detect its ischemic causes and non-ischemic causes as well. And then we discussed pathological Q waves and T wave inversion and their clinical significance, whether in myocardial ischemia or in non-ischemic causes. Then we have a fabulous lecture, which of course gains attention of many of the viewers, which is the atrial infarction, which is a famous category that of course is neglected in our clinical practice, and how to diagnose them with its ECG features. And then the strange TA wave and the atrial repolarization wave, which of course is mostly forgotten in ECGs. And then we discuss, of course, the localization of myocardial ischemia, which was one of the very successful lectures in the ECG course, and how to localize it. And then we have 4 separate lectures regarding culprit in anterior STEMI, culprit in lateral STEMI, culprit in inferior STEMI, and culprit in posterior STEMI, which were, of course, the end to the season 2 in the ECG course. Now it's time to tell you a nice surprise that soon I'm going to release my own channel on the YouTube, which is Cardio Minds. In this channel I would present short interesting videos in my own way in order to cover many aspects in the clinical practice of the field of cardiology, and I promise you to present these topics in interesting ways that would gain your attention. And so wait for interesting videos in this channel, and so it would be coming soon. Thank you very much for your interaction, and wait for more interesting lecture in the ECG course and also on Cardio Minds channel. Thank you.